So welcome to our podcast series on oral bites, where we dive into topics that both affect your overall health and your dental health. And today we're focusing on a medication that many of you may have heard of or even used, which is methotrexate. We're going to explore what it is, what it's used for, how it could potentially influence dental treatments, specifically dental implants, obviously, and whether you're a patient considering dental implants or you're a dental professional curious about the drug interactions, this episode you hopefully will find useful. So what is methotrexate? We'll start with the basics. Methotrexate is a medication. It belongs to a class of drugs known as the anti-metabolites. It's been around for quite a long time now, originally developed for treatment of cancer back in the 1940s. But as things have moved on, it's commonly prescribed for non-cancer conditions such as autoimmune diseases and various inflammatory disorders. It works by interfering with the body's normal use of folic acid, which cells need to divide and grow. And because of this action, it's effective in slowing down the rapid growth of cells, especially immune cells, which are responsible for inflammation and autoimmune disease. And what you may find is that on certain occasions, some patients might be given a supplement of folic acid, depending on what they're taking methotrexate for. What conditions is it commonly used for? Well, it's commonly used for rheumatoid arthritis in both adults and the juvenile form of arthritis as well. It's often used to reduce inflammation, slow the progression of the joint damage down. In psoriasis, it can be used when that's quite severe. You might find some of our patients, or you might be prescribed this. Helps reduce that rapid turnover of skin cells. Lupus, it's prescribed for that to manage the inflammation that's sometimes seen with some of the patients that have this, which obviously again is another autoimmune condition. Crohn's disease, it's sometimes used for that to help patients control the inflammation, and it's still less common these days, but it's still part of the chemotherapy arsenal for certain patients, such as with cancer, such as leukemia. While it's beneficial for many of these conditions, we've got to understand that it does have side effects like all drugs, especially long term, which is very important when it comes to implants because they are a long-term solution. How does it work? Well, exactly how it works. It inhibits dihydrofolate reductase. It blocks the conversion of folic acid into its active forms, which is crucial for DNA synthesis within the cells and cell growth. Slows down that rapid division of cells, which is great for controlling inflammation and again, slowing that cancer cell growth down. But obviously, it affects the normal fast-growing cells and other cells as well, such as bone marrow cells, hair follicles, and the cells that line our gut or our GI tract. Because methotrexate can impact the immune system, its long-term use does require careful monitoring. So the team that prescribe it will be monitoring you or our patients, and they'll manage that dosage and look at the side effects, such as potential liver toxicity, monitoring the blood cells, making sure that they're not dropping too much, and susceptibility to infection. So let's shift our focus to dental implants. So we know that dental implants are becoming more and more popular. They're an effective solution for replacing missing teeth. But there is a medical procedure involved, and that is a surgical procedure, which means that that body's got to heal, and we're going to need bone and gum to heal around our implant site. And therefore, for this to happen, that's going to give us that long-term success. So what considerations do we need to make for patients that are taking or potentially going to be prescribed methotrexate? Well, one of the key points potentially is delayed healing. So it can suppress the immune system, so it can slow down the healing process. So after surgery, that body needs to regenerate that bone and soft tissues around that implant site. And the methotrexate potentially could lead to slow recovery times. So what we might want to do is we might want to extend the time at which the implant is left before we consider loading that implant. We may want to consider whether we're going to, if we are considering placing the implant immediately and loading it immediately, is that something that we want to do for our patients on methotrexate, or do we want to consider the alternative options, such as a conventional approach, which means placing the implant, allowing that bone to heal, and then going back in a few months later, checking that it's all healed. The healing time can vary. So some implantologists, as mentioned, they might place an immediate implant and load it immediately. Sometimes we might decide that we're going to look at sort of 6 weeks, 8 weeks, 12 weeks or longer. And on patients that are on methotrexate, because of this sort of potentially delayed healing process, we might want to extend that a little bit, which leads on to that bone regeneration, that osseointegration process where the bone is growing around that implant that's been placed. And when we look at sort of patients that are on methotrexate, there is an association with reduced bone formation. And some of the studies, although not high-powered studies, that they sort of do suggest that methotrexate therapy can impair bone healing, and that can affect the stability and the longevity of dental implants. So again, patients that are on methotrexate that have implants or are considering implants, we might want to look at our sort of risk profile and our recall periods and reduce those maybe to every 3 months rather than every 6 months. Increased risk of infection. Well, methotrexate does suppress the immune system, so patients could be at a higher risk of infection following implant surgery, although the implant process is usually done in a very sterile environment, draped up, gowned up. So that initial period after placement, it's crucial for avoiding infection. So making sure that post-op routine, warm salt rinses, if you're using any antiseptic rinses, chlorhexidine, if the patient is non-allergic, to make sure that we're reducing that infection. Antibiotics, whether you prescribe them pre-surgery or post-surgery, considering those as well. And then the interactions, well, that comes on to the antibiotics, making sure that the antibiotics we prescribe don't have an interaction with methotrexate, because it does interact with certain drugs. Certainly, there is an interaction with non-steroidal anti-inflammatories. So we need to coordinate very closely with the patient and the team that are prescribing the methotrexate to make sure that everything is okay. If really need be, doses could be adjusted, I guess. It's not something that I'm hugely keen on, but it's an option that you have. So evidence-based, well, the research is still weak. We need more research on it. It's not huge, but it does look like, from some of the case studies that are coming out, that there is a higher risk of implant failure with patients on methotrexate when we compare them to patients that are healthy and not on methotrexate. But it's important that we interpret these results very carefully. It doesn't mean that patients on these medications, or if you're taking these medications, you can't have an implant. It's something that you should have a discussion with your implantologist, or as implantologists, we should be having a discussion with the patients, making an assessment. We have to weigh up lots of other factors. There are other influences that come into play. We understand about diabetes, periodontal disease, smoking factors, other drugs that may be there, the overall health of yourself as a patient or the overall health of our patients. So these are things that we need to have that consultation for and understand. So timings, we might decide to adjust the timings. Post-op care, we might adjust the post-op care. Medical history, we need to go through the medical history. Collaboration with the whole team, making sure we're giving the patients the most appropriate care, or you're getting the most appropriate care. And then post-surgical monitoring, making sure that we're doing that appropriately. So it is an effective medication at managing some of these autoimmune and inflammatory conditions. But there are some challenges when it comes to things like implants that we need to understand, and its impact on our patients or as a patient in terms of potential complications. And again, I'll emphasize, it doesn't mean you can't have implants at all. It just means that you need to consider these factors and make sure that you're comfortable with them if you are a patient, and if you are an implantologist, having that discussion with your patients again. Hope you find some of this useful, and keep smiling.